Hello, my name's Tom. I'm a level 1 nursing student. I was wondering if I could follow you with Shanae O'Connor. Can I get an S-bar on her?
Yes, Shanae O'Connor. She's 34 years old. She weighs 177 pounds. She's a full coach. She has an allergy to trimethoprim. She has renal disease. She's low risk for falls. She's not at risk for pressure ulcers. She came in to us with a fever of undetermined origin, secondary to end-stage renal disease. Diagnosed about 1 year ago and is on regular hemodialysis schedule. She's type 1 diabetic. She had a graft about 3 months ago. It was infected, but it was resolved with antibiotics. She does have a history of reoccurring UTIs. She has reports of elevated capillary blood glucose over the past few days as well. Her Perla was good. She has no abnormalities with her ears or nose. Her tympanic membrane was clear and intact. Mucosa membrane was good, wet, gums were pink and firm, and she also wears glasses. Her chest expansion was symmetrical. All lung sounds are clear, and she quit smoking 2 years ago, so she tells us. She's a little tachycardic, otherwise she's got regular rhythm. S1 and S2 are present. No murmurs or extra heart sounds. Slight 1+ non-pitting edema in lower extremities. Femoral pulses 2+ bilaterally. 1+ pedal pulses in both feet, and the capillary refill is less than 4 seconds. Abdomen was soft, round, and regular, no visible masses. There were sounds present in all 4 quadrants. Patient reports weight gain of 10 pounds over the past few weeks, decrease in diet, and decrease in intake and output. Patient reports decrease in appetite, decrease in frequency of urine, and avoidance of urine. Urine has become more concentrated and darker in color. Her urine analysis came back, and it's amber urine with a pH of 4.7. The specific gravity of the urine was 1.005. And we're going to treat her today for a potential UTI that we're relatively sure that she has. White blood cell count is 15, and so we would like that to, be within 0 to 4. We're going to give her some anapenum, I think is how, or otherwise known as Permaxin. So that's what we're going to give her to treat for the UTI. Some other information: her past vital signs were last taken at 7:30. Her temp was 101.1, so she still has a slight fever going on. Her heart rate was 95. Her O2 stats were 96, which is good. And her blood pressure was 136/78, which isn't too bad. We're still waiting on her CBC, her metabolic panel, urine culture, and yeah.
So why is this client receiving this medication, and what action does it have on the body?
So she's receiving this medication because we're pretty sure she's got a UTI, and so we're trying to be proactive and treat it before it festers even more. And then what the medication does is it breaks down the cell wall of the bacteria causing the UTI, and when you break down the cell wall of bacteria, the bacteria dies.
When should you question administering this medication?
You should question administering the medication if the patient has any kind of allergies to this particular medication, or if it's inappropriate for the patient to get the medication if the patient's already showing signs and symptoms of a previous adverse drug reaction, withhold the medication, or if the physician has ordered a dosage of this medication that is not within therapeutic range for a patient of this weight or age.
Does it have a therapeutic serum level?
It does not.
Which vital signs must be monitored?
The vital signs that must be monitored, mostly, you really just want to check on the temperature. If the temperature starts to go down, you'll know that the infection is probably starting to subside. But if the temperature spikes, then we could potentially be dealing with a super infection on our hands caused by the antibiotic that we're giving her. So temperature is a big one, as well as heart rate.
Which physiological parameters should be monitored when the medication is being administered?
You just want to make sure that the IV site's good. You want to make sure that the patient doesn't have a fever. You want to make sure that they're not sweating or anything like that, or having any kind of diarrhea.
And which interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to make sure that the patient knows that the nurse administering the medication is exercising the 5 rights of patient medication administration. Those are the right patient, right time, right date, right route, and right dosage. So yeah.
What about safely at home?
Safely at home, the patient, it's very important that they follow the routine of the medication and that they don't just stop the antibiotic whenever they're feeling better, because a lot of times people will stop the antibiotic regimen halfway through. They feel better, and then they get the infection again. They're put on that same antibiotic, and then it's not as effective this time around.
What are the side effects and potential adverse reactions?
You can get a bit of a drug fever from this medication. A big one is diarrhea. That could be indicative of a super infection. Those are really the 2 big ones that you want to monitor. Anaphylaxis could also be a side effect if the patient's allergic to this medication, which she is not.
And how will you know the medication is effective?
You'll know the medication is effective when we get our labs back and we notice that her white blood cell count is starting to go down, back to more therapeutic range. Her fever will start to subside, and it won't be as irritating for her to urinate, and her urine should appear normal in color.
All right, I think that's everything.
Okay, perfect.
Hello.
Hello, can you tell me your first and last name, please?
Shanae O'Connor, and I'm 34 years old.
Thank you very much. My name's Chris. I'm going to be your nurse today. So what you have is the physician has ordered you to get some Premaxin, and so then we're going to administer that for you today.
All right.
Because we want to make sure that you don't have an UTI festering, and so if you do, this is going to help cure that, okay? Do you have any pain right now?
I do not.
All right. And do you have any other allergies other than the one listed here on your wristband?
No, I don't think so.
No? Okay. Good. And you said you have no pain? All right, I'm going to test your IV site to make sure that the site is still good for our IV. Now the Premaxin I'm going to be giving you is IV piggyback, and we're going to piggyback it with 0.9 normal saline. So I'll hang that first, and then I'll hang the medication right here.
Sounds good.
I'm going to scrub this for 15 seconds. 5, 10, 15. Good. Then I'm going to push on the plunger. I've got no resistance. Good. We're going to undo that. Oh, you know what, actually? Hang on. Okay, yeah, it's still good. Alright. Now, got to hang the normal saline. And one more time, can you tell me your first and last name?
Shanae O'Connor.
And how old are you, Shanae?
34.
34. Good. So your wristband, please. Then I'm going to take the normal saline, compare it to the MAR, put it up against the screen. Expiration date's good, dosage is right. Perfect. uncap this, keeping the tip of the spike sterile. I'll unplug my normal saline, make sure that we're clamped off. We are. And then I need to scan this in. So yeah, okay, so that's scanned in. Spike it. And then we're going to uncap. We're going to uncap the tip of this. So now this is sterile. And I'm going to prime the line. Okay. Take this. We're going to unscrew this. We're going to wipe it down for another 15 seconds. 1, 2, 3, 4, 5, 10, 15. Now that that's scrubbed, we're still going to keep sterile and going through here. Good. Now that line is hooked up, I'm going to label it. I need to label the tube, the date, the time, and also the date and time to change it. And now that that's labeled, put that on my tubing. Perfect. Make sure we're good. Primed. System on. New patient. Yes, medical surge. Okay, let me see your wristband, please. 8247. 8247. 823. Okay. Confirm. Channel select, guardrails, normal saline. Yes, that's correct. 30 mils over 500. And we're going to start that. Now we can unclamp this bad boy. And wait for it to run. Alright, so we're going to undo this. We're going to check our line. Okay, so it appears to be running good, and now we need to watch the 5 drips. One, 2, 3, 4. Come on, 5. Come on, 5. Good. All right. Now one more time, tell me your first and last name, please.
Shanae O'Connor.
And your age.
34 years old.
Perfect. Okay. So, can I see your wristband, please? Good. Now I'm going to take the medication, compare it to the screen here, make sure that it's the right expiration date, right dosage, the right medication. Everything checks out. Gonna scan. Alright, now we need to hang this IV piggyback. What I'm going to do is I'm going to make sure that this is clamped. Then I'm going to take my bag, I'm going to uncap it. I'm going to take my spike, uncap it, keeping it sterile. I'm going to push it in, good. And we're nice and clamped. Then I'm going to go over here and get my alcohol swab. I'm going to wipe this down, 15 seconds, 5, 10, 15, good. Now I'm going to uncap this guy, keep it sterile. Alright, now I need to back prime us. So, going to unclamp, back priming, and we're good. I'm going to go ahead and hang my saline low. Perfect. Now that that tube's in, I'm going to label the time that I put the tube up and the date, and label the time and date and initial when to change it. Good. Now it's time to set our pump. So we're going to go to channel select. We're going to go to secondary. We're going to go to I, Impinenum, and then we're going to do this one right here. Impinenum, Celestin development. Let's check it. Check it against the MAR. 500 milligrams. 3 hours. Yep. Is this dosage correct? Yes. Dose 500 milligrams. Next. Rate 500. And we're going to do here. So 100 milliliters an hour. Volume to be infused is 100 milliliters. And then we are good to go. And start. Make sure that we're unclamped on our piggyback.
Hi, Stephanie.
And we are.
Good. My name is Marty. I'm a level 1 nursing student, and I was wondering if I could.
And then everything seems to be running good. We're going to do our 5-drop check.
Is it okay if I ask you a few questions? Sure. Why not? Can I get an S1 on the patient? Okay. So this is Ms. O'Connor. She's right here in room 231. She's a 34-year-old.
One, two,
She presented with fever and chills in the ER. General malaise. She has a history of type 1 diabetes with readings and a decreased appetite for the past 2 years.
three,
Also, a history of renal failure and congenital urine output for the last month with a history of
four,
UTIs.
5. Okay, good. Alright, let me check that. It's running. Everything's unclamped. Our line's good. All right, perfect. And you did say that you still have no pain, right?
No pain.
In that IV site, that's not bothering you or anything, right? All right. I know you said that you had a little bit of, you were wondering about this medication and how it works a little bit. Some of the side effects that you want to watch out for are going to be diarrhea, an increase in your fever. Let me know if you start sweating. And then I went ahead and I actually printed out more information for you in regards to this medication and other antibiotics like it. So go ahead and take a read there.
All right, thank you.
Are you able to read the information on that page?
Yeah, be all
Based
right.
off, just glancing at it, is it making sense?
Yeah,
Okay.
looks right.
All right. Is there anything else I can do for you while I'm here?
No, I think
No?
that's it.
Okay. Labeled both tubes. We're running, and we're good to go. All right. Let me know if you need anything else, okay?
All right. Alright, so I have a couple questions.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
I wanted to make sure that I knew who the right client was, or what the right dosage was, the method of administration, how and where to give it, and the rate to infuse it over.
Did this information affect your decision to administer the medication?
Considering everything seemed to line up and be appropriate in terms of dosage and the fact that she didn't have an allergy to this medication, nothing affected the way I administered it other than the fact that it needed to be given via piggyback, so that's how I gave it.
Did this information affect how you administered the medication?
Like I said, IV piggyback was the way that I administered it because of the orders that were put in. And she didn't have an allergy to the medication, so there
Alright.
was no reason to halt.
Alright, thank you.